Welcome back to Domains and Dimensions in Applied Behavior Analysis in Early Childhood. This is video part 10, beginning with Objective 23. Identify the defining features of the conceptually systematic dimension of ABA and list some irrelevant features. In analysis, let's review a little bit first. So the mnemonic I told you about earlier was ABATECG. And we've covered the applied dimension, behavioral dimension, the analytic dimension, and the technological dimension. Now we're on to the conceptually systematic dimension. It's an analysis of behavior-environment relations is conceptually systematic if the intervention and its effects can be described with reference to established principles of behavior. So principles of behavior are reinforcement and punishment, motivating operations, stimulus equivalence, stimulus generalization, stimulus discrimination, response differentiation. Features of an analysis which are irrelevant to the conceptually systematic dimension. Maintenance or generalization, that's the generality dimension. If behavior change is due to the intervention, that's the analytic dimension. Intervention effectiveness, that's the affective dimension. Social significance, that's the applied dimension. The size or direction of the behavior change doesn't matter, but the size of the behavior change is related to the affective dimension. The specific procedures used doesn't matter. The clarity and precision of the description of the specific procedures is the technological dimension. The type of behavior targeted doesn't matter for conceptually systematic dimension, although if the behavior is socially significant, that meets the applied dimension. So here are some examples of conceptually systematic dimension of an analysis. When the boy engaged in challenging behavior consisting of hitting, kicking, or throwing items at others, the adult required him to stand up and sit down 10 times. That's contingent exercise. Now this consequence decreased the future probability of the behavior. Thus it functioned as positive punishment. So positive punishment is the principle used to interpret or explain the outcome of this intervention. When grandma was present, if the boy asked for cookies, he received them. When mom was present, the boy was denied cookies. Now the boy only asked grandma for cookies. This arrangement functioned as differential reinforcement, which established grandma as an SD for positive reinforcement in the form of access to cookies. Now here are some non-examples of conceptually systematic. In the past, the boy was very disruptive in class. After the intervention, he stopped being disruptive because he learned to take responsibility for his actions. So no reference to basic principles of behavior. The girl refused to help with dishes in the past. The behavior analyst worked with the family to increase her compliance with chores. Now she does more chores because she really wants to impress the behavior analyst. There is no reference to principles of behavior in that scenario. Before, he could barely stay in his seat, and then he received the ABA therapy. Now he can sit for longer periods of time during instruction because his attention span is improved. But we know attention span is a mentalism. It has nothing to do with basic principles of behavior. Okay, so we're proceeding with our next objectives. Objective 24 is discriminate between examples and non-examples of the conceptually systematic dimension. And then objective 25, identify the defining features of the affective dimension of applied behavior analysis. List some irrelevant features. Objective 26 is to discriminate between examples and non-examples of the affective dimension of applied behavior analysis. And then 27 is to identify the defining features of the generality dimension of applied behavior analysis. List some irrelevant features. 28, discriminate between examples and non-examples of the generality dimension. And then 29, discriminate between examples and non-examples of the dimensions of applied behavior analysis. So now we're on to discriminating between examples and non-examples of the conceptually systematic dimension, ASR 35. If your interpretation of the intervention and its effects are based on reinforcement, stimulus generalization, stimulus discrimination, response differentiation, punishment, or other principles of behavior, then it's probably A, conceptually systematic, B, behavioral, C, analytic, D, technological. Couple more seconds. Alright, I'll close the poll. The answer here is A, conceptually systematic. ASR 36, could the behavior environment analysis still be conceptually systematic if there is no change in behavior or the change is small? A, yes, B, no. Couple more seconds. All right, I'll go ahead and close the poll. The answer here is A, yes. Because we talked about earlier how it's irrelevant whether there's a big change in behavior or if there's any change in behavior at all. Doesn't matter. It's conceptually systematic if you interpret behavior change or even the absence of behavior change in terms of basic principles of behavior. ASR 37. Jake learned to discriminate between P, B, and D by saying the name when shown the letter. In other words, he finally understands what these letters mean. Is this explanation consistent with the conceptual system underlying behavior analysis? A, yes, B, no. A couple more seconds. All right, I'll close the poll. The answer here is B, no. Because it's understanding has nothing to do with this. Discriminate, yeah, but, there are no principles of behavior referred to in this scenario or in the interpretation of Jake's, new skill here. So the moment this started to refer to understanding what the letters mean, it exited a conceptually systematic interpretation. Okay, objective 25, identify the defining features of the affective dimension of applied behavior analysis, list some irrelevant features. So the mnemonic was A, B, A, T, C, G, and we've covered the applied dimension, behavioral dimension, analytic dimension, technological dimension, conceptually systematic dimension. Now we're on to effective. An analysis of behavior-environment relations is effective if the analyst demonstrates a significantly large improvement in behavior. The significance is subjectively determined in part by the consumers of the service. So features of an analysis which are irrelevant to the affective dimension, maintenance or generalization. That's the generality dimension. Specific procedures used, doesn't matter. Type of behavior targeted, doesn't matter. If the effects can be explained in terms of basic principles, well, that's conceptually systematic dimension, right? So I'll give you a few more seconds to fill those in. All right, so here are some examples of the affective dimension. The intervention decreased stereotype behavior by 90% of baseline. That's a large, meaningful change in behavior or improvement in behavior. So that we would say that's meets the affective dimension of ABA. Self-injurious behavior decreased from 10 times per hour to less than once per week. Again, a large, meaningful improvement. The intervention taught the student 50 new math facts in a few months. That's a big increase in math skills. What would be otherwise referred to as math knowledge here. The intervention resulted in the child having dinner with his family, eating what his family prepared for him, transitioning well to and from meals after never having dinner with his family for 5 years. That meets the affective dimension of an analysis. The boy went from wetting his bed every day for 4 years to staying dry at night permanently for 6 months. He's cured of nocturnal enuresis there. That's an example of the affective dimension of an analysis. Non-examples. Stereotype behavior decreased by 20% from baseline. That's too small. Too small of a change. Self-injurious behavior decreased from 10 times per hour to 8 times per hour. Too small of a decrease. The boy went from wetting his bed every day for 4 years to staying dry a couple of times per week for 3 months. No, too small. Relative to the examples above, those would be really too small of changes in behavior for us to say the intervention was effective. Objective 26, discriminate between examples and non-examples of the affective dimension of ABA. ASR 38, after 6 months of feeding therapy, the boy with food selectivity and autism learned to accept one new food with his dinner. Was the intervention effective? A, yes, B, no. A couple more seconds. All right, I'll close the poll. The answer here is no. Maybe 10 new foods, or even 5 new foods, depending on how many foods the child ate before intervention. But 1? Probably not. significant. ASR 39. The man with an intellectual disability learned to brush his teeth independently for about 10 more seconds after 3 months of therapy. Was therapy effective? A, yes, B, no. Couple seconds. Alright, I'll close the poll. The answer here is no. Now, if the man learned to brush his teeth independently for a minute and a half, hey, that's a huge improvement for this individual, probably. So that would meet the affective dimension. ASR 40. The boy with autism could not imitate, but his ABA therapist taught him to imitate 20 new gross motor and fine motor actions in only a month. Was therapy effective? A, yes. B, no. Couple more seconds. Alright, I'll close the poll. The answer here is A, yes. Alright, that wraps up this video part. See you in the next video part, beginning with objective 27.